Can a 3-minute test give you clues about your mental health? That is the premise behind the What's My M3 screening tool. For this week's Take Action Thursday, Dr. Stephen Davis, the Chief Medical Officer for What's My M3, is joining us to tell us more about what it is. Good morning.
Good morning, Patrice.
All right, so what is the test? How does it work?
So What's My M3 is a test that has 27 questions. It takes about 3 minutes. And this has been developed over the past 8 years by some NIMH researchers to ask questions about not just depression, but the most common mental health problems.
Like, give me an example of some of the questions they may ask you.
So a common question would be asking about, have you had a loss of appetite? Are you having trouble sleeping? Are you having trouble functioning at work?
And so once you answer that series, that can give you an idea, or it can give doctors an idea about where you fall in the range of mental health.
That's right. There are a lot of overlap between some conditions. So many people with depression also have an anxiety disorder problem. 20% of people who have depression symptoms actually have a bipolar disorder. And many of them are undiagnosed because commonly primary care practices do the most treatment for mental health conditions. They usually screen for depression. They don't usually screen for bipolar disorder or anxiety disorder, and this does all of those.
Now, that's got to give you an idea, but then are there further steps beyond that, further tests that need to be done? Because this seems very general.
That's right. Well, this is so with any sort of screening type of test, what you're trying to do is find those ones that might have it and differentiate those who probably don't. And the ones who might should move on, if they're concerned about it, and at least visit their primary care doctor and say, I took this test, here's the answers, what do you think? And they'll usually ask them more detailed questions.
And it's a good first step because there are so many mental disorders that go untreated, or people don't realize this is what I have, or there's something going on.
That's right. And a lot of them maybe do, but don't know the extent of it. And then it can be helpful to get kind of a number. I kind of think of this as a brain lab test in a way, because it gives you a number, something quantifiable that you can look at over time, and it's been compared to a gold standard to show that there's a lot of overlap between a positive answer and an actual diagnosis. And
you think that if more and more people do this, or more and more people know their mental health state, it could actually decrease healthcare costs overall?
Absolutely. Studies have shown that undiagnosed and untreated mental illness and substance abuse problems can sometimes, especially in people with other chronic medical conditions, can double the health claims cost.
Where do you get the test done? How do you do it?
There's an app called What's My M3 on both iPhone and Google. There's also what'smym3.com.
Very easy to do then.
It is. And we also have, and that's all free and anonymous. We also have something called M3 Clinician. M3 Clinician is essentially a professional version that a primary care doctor might use. All
right, we're going to get you to stick around and answer some more questions for us. So right after the break, Dr. Davis is going to take your calls about mental health. So if you have a question, the phone lines are open right now at 410-481-4545. You can also send us a tweet or go to our Facebook page. 7:54 is the time. You're watching Fox 45 Morning News, all local, all morning. We are back with Dr. Stephen Davis, Chief Medical Information Officer with What's My M3. He's taking your calls about mental health for our Take Action Thursday. If you have a question, our phone lines are open 410-481-4545. We do have some callers on the line right now. Our first caller is Sharon in Baltimore. Good morning, Sharon.
Good morning.
What's your question?
My question is, first I was diagnosed as schizophrenic, and then I was diagnosed as bipolar. Now I'm diagnosed as schizoaffective. I was wondering, do your mental illness get worse as you get older?
So it depends on the illness, but for the most part, it tends to get better. It gets better over time. The reason why it gets better over time is people learn how to live with their condition. And they learn things that make it worse or make it better, and so they avoid those things that make it worse. There is what you described, this condition called schizoaffective disorder, which is a lot of symptoms of both schizophrenia and bipolar disorder. And in general, that tends to get better over time.
That's the good news then. All right, thank you for that call, Sharon. Let's go to Jean in Edgemere. Hi, Jean.
Hi, how are you?
We are great. What's your question?
Well, I want to know why my doctor said that I was depressed and offered medication when I consider myself being overwhelmed. I have a lot of things going on, but I don't sit around and feel sorry for myself. It hasn't stopped me from functioning in my normal way of life. So I'm trying to figure out why someone would tell me I'm depressed when I don't feel so and offer me medication when I don't want any. I know it's so.
That's a good question. I'll tell you, taking medication is not going to help you feel less overwhelmed when your life is overwhelming. I mean, there's a lot of things that happen in life. So oftentimes, somebody that takes the time with you and can find out what is overwhelming in your life and give you some suggestions as to how to maybe reorganize some of that. Sometimes psychotherapy to help you deal with stress better, because maybe you don't have enough outlets for that stress to come out. It's definitely not something that a medication should be used to fix in general. I think a test like this, What's My M3, helps you to differentiate between those two things, because one of the questions asks you about your ability to function at work. And if, one of the key things about diagnosing depression is if you can function, then you don't have a clinical depression.
All right, great questions, great answers. Thank you so much for being with us today. We appreciate that, and good luck to all of you who had questions.
Well, can a 3-minute test give you clues about your mental health? That is the premise behind the What's My M3 screening tool. For this week's Take Action Thursday, Dr. Stephen Davis, Chief Medical Officer for What's My M3, joins us. Thanks so much for coming in.
You're welcome, Jennifer.
So this is so interesting. This is 3 minutes that you can take to get a quick assessment of your mental health.
Yeah, this is something that was designed by NIMH researchers. And in 3 minutes, it's 27 questions, and we've boiled it all down to the essential questions, and it tests for major depression, bipolar disorder, anxiety disorder, PTSD, and there's also a drug and alcohol abuse screen.
Okay, so, you think, what can you learn in 3 minutes, but you get some valuable information. Obviously, you should not stop there if you are identifying something in that test.
Yeah, well, it's not a diagnostic tool. You really need a provider, a physician, a nurse practitioner to diagnose it. What it gives you, though, is a sense of your relative risk of having one of these conditions. And if you score above a certain number, then your risk is actually pretty high. And you would take these questions to your doctor. You'd print this out and say, I took this test, this is what it shows, what should we do next?
Right, and why did you put this together? What's the purpose behind it?
So really the purpose is, in America, it's very hard sometimes to get access to mental health treatment. And mental health conditions are typically underdiagnosed, and they're frequently treated by primary care doctors. In fact, the majority of mental health conditions are treated by primary care. And in today's fast primary care world, they need some tools that the patients can use themselves and to speed things along, but also give them the tools to engage with the patient. And this is something that you can, if you have a condition that's being treated, say depression, you can take this once a week, once every 2 weeks, and track your improvement over time.
And it's free?
Yes.
And
it's free
how do
and
we
it's
do
anonymous. You just go to whatsmym3.com. Is the website. We also have a professional version called M3 Clinician, and where providers can pay a subscription fee and track all of their patients in their practice and do a better job of managing and treating them.
And you made the important point, it is also anonymous.
It is.
All right. Dr. Stephen Davis, thank you so much for coming in and sharing this valuable tool with us.
You're welcome. Thanks for having me.